Thank you. Please proceed.
Thank you, Mr. Speaker. As we all know, I have various experiences in emergency medical services. And I want to speak a little bit about those experiences because I think when we all look at what we want for our families, certainly when I'm training paramedics or when I've been part of the emergency services system, what we want is the best quality. We never want to see anybody die. The reality is people do die, and they will continue to die. I will not stand here and promise anybody that nobody will die. I've been in that elevator when we thought everything was going okay, in an apartment building where the elevator barely fits the stretcher, 2 paramedics and a patient, talking to the patient 1 minute and having them crash on you in the next. And you know what? The elevator doesn't move any quicker when you're 27 floors up. You can't do effective chest compressions. You can't get your medications in that you want on time. It's a situation that's unfortunate, but I won't stand there and I won't blame the elevator company for the way they designed the elevator or the building. It is what it is, and I'll accept responsibility for that. And the tough thing is having to talk to the other people that couldn't get in the elevator, at the bottom of the elevator, that you just said goodbye to your patient, and now, or to your family member, and now we're working on them. I'm sorry, you can't even drive in the front because we've got to go. And when they get to the hospital, unfortunately, I've had to give that information to those loved ones that patient passed away. So the severity of what we're talking about here is not light, and it is not something that politics should be played with. It's not something that you hire a group and run them around to scare the hell out of Albertans, Mr. Speaker. Mr. Speaker, when I made a commitment to do no harm, part of that doing no harm is making sure people have accurate information to make informed decisions, to be sure that we're instilling confidence in the systems that we have today, to make sure that we build on our strengths and not try to rip them down every time there's change. Now let's talk about that change for 1 minute. There's a person that sat in this legislature in the very front chairs that I respect immensely. And most Albertans did, and we've heard about it over and over again since the budget has been delivered, and that's Mr. Ralph Klein. And in the late 90s, what the Klein government decided to do was shut down not just one major hospital in downtown Calgary, but 2. That's where people received emergency care. And he shut those down simply because there was better economic value in building hospitals in other areas, one being named after our most beloved Premier, and that's the Peter Lougheed that we know today. So what I will tell you is this. When those changes came, there were almost 1 million people that were terrified for fear of what physicians were saying, because particularly people, those in downtown Calgary, worried about access to care, not just care from an emergency perspective in terms of ambulance, but we were also looking at the ability for nurses to provide in and out care and so on, and specialty care for those who lived in downtown Calgary. But as we all know, that transition took place. We're providing better care at the centres of Peter Lougheed, the Rocky View. We have just built one of the state-of-the-art hospitals that not just mentioned in Calgary or around the world, it's mentioned around the world as being state-of-the-art. And that's what we have here. So let's talk about the facts, Mr. Speaker. What we have here and what we've heard is that the Health Quality Council has come out with a bunch of numbers, and you know what? The time has doubled. Well, has anybody on this side ever done the research in terms of where those times were determined? As a paramedic, I know there's a difference between emergency care and emergency driving and regular traffic for those regular patients. And all those times were calculated with people going through regular traffic. But Alberta Health Services, again, went one step further to make sure for those regular traffic patients, because you cannot evaluate the emergency traffic, because you can't fire up an ambulance and drive it through downtown Edmonton or anywhere else without a patient in the back. It's against the law. But they ran those times early in the morning, between 7 and 9 in rush hour. They ran them at noon, and then they ran them between 5 and 6 during probably the worst time that highway ever receives traffic, and those are the times that they came up with. I was talking to an Air Medevac flight pilot who's done it for 11 years. And he says anytime we've come into the international airport, and let's be sure that there were 63 flights, 7 of them being red, with no problems at all, Mr. Speaker. The flight pilot calls in, he says, I need priority. He gets the priority that he needs. And this is from an experienced person. He has no gain in it, nothing. In fact, he doesn't even do that anymore. And Mr. Speaker, when we taxied, and when he says we taxied, and when we taxied on our plane yesterday, slightly different, it was 3 minutes. He said, worst case scenario, weather being terrible, crosswinds being terrible, it's 10 minutes. That's from somebody who knows, Mr. Speaker. Now let me tell you something that I know because I've done it in Calgary for over a decade, picked up medevac patients, equal or more the amount of people that are being flown into Edmonton. And I've journeyed to the foothills, Calgary, which is not a direct line. It is through traffic, and it is almost exactly the same setup that we have now with this new state-of-the-art ability, with ambulances that have the ability to take the stretcher from the plane right onto the ambulance. In Calgary, we don't have that yet. We have to blanket drag them. We do it outside. It's cold for the patients. There's wind. There's planes firing up all over the place. But you know what? There's no incident there, Mr. Speaker, because the physicians that start the care in the beginning and the nurses all care. The paramedics, the pilots, they all care, and they know when it's serious. Mr. Speaker, what we're being told here in terms of the facts is that we need a lane. A lane would be great. But, Mr. Speaker, I can tell you, when I turn the lights on to that ambulance, I've got every lane. And when we look at some of the stats, because I sat in the St. Paul meeting for Save Our Medevac, when I saw those stats, the St. Paul Medevac, and you should be aware of this, they put up a picture of an ambulance stuck in traffic without its lights on, and how dare they say that there's a patient in the back of that ambulance dying? Because that is false. Because otherwise the lights would be on, it'd be going right down the right of way of the shoulder that we all saw in there. And that's what I know. And you know it. Mr. Speaker, what we're being told, and these poor Northern Albertans are being sold snake oil. It is not the truth. And you know what? I respect the physicians because I talked to those physicians. In fact, 50 physicians were consulted in this process over a year ago. They are highly decorated physicians from emergency rooms, from ICU, from specialized care all over Northern Alberta. They all received a letter. But here we are in an emergency debate one day before we're going to move to a state-of-the-art medevac service ability. And what I hear on this other side is, Rick, you don't know. You're not a doctor. Well, you know what, Mr. Speaker? Here's what I can tell you. I'm an advanced care paramedic. I've been out there in the ditch. I've had to make the decision, the hard decision, based on the resources I've had, to walk away from children that are taking their last breath to deal with the person who's drank too much and decided to get in their car. You tell me that I don't know. Because I tell you, if it isn't for the work, the hard-working paramedics that are on the street and in your community saving the lives to get them to these physicians, those patients don't get there. And I'll tell you what, if we're going to evaluate it, let's evaluate the whole thing. Because not every instance in medical care is black and white. It's often very gray based on the decisions. And I look back over my career, and I tell you, there are times when I look and I thought maybe I made a mistake. Maybe I waited too long. Maybe I didn't call in the additional resources. And you know what? I can tell you from the caring, adequate, awesome physicians that we have in Northern Alberta, have the same questions. So when we evaluate a call, we evaluate from the time it comes in to the very minute it ends. And that call just doesn't end when we get them to the hospital. It doesn't end in the trauma room there. It doesn't end on the ward. It may end 24 hours, 48 hours later, and we all own the responsibility of the care that we provided. Now, there's no debating, and in fact, the Minister of Municipal Affairs had the meeting with Mayor Mandel yesterday. They are eager to move forward on the development of that airport, and what this government has done is we've got out in front of it. We have decided to make a decision, albeit not easy, because I can tell you what, if I could put an airstrip right next to every single hospital, wouldn't that be great? But is it economically feasible, and do the stats tell you that? Let me reiterate the stats for you one more time. 92% of the people that were flown into Edmonton were actually regular traffic. They were not emergent. They might have been ICU, but they were stable. And there is a difference between a stable... That's fine. Mr. Speaker, here's what we know. In fact, the statistics at the end of the day, those time-critical patients based on the dispatch information that actually came in. And you know where the dispatch information comes from, Mr. Speaker? The very doctors that send the patient, because they're the ones talking to other doctors on the other line. The rapid scene that says, hey, I've got this patient. Okay, let's fire up the bird and let's get him going. That's where the dispatch information comes from. They send them out. And in fact, what Alberta Health Services has done, the Health Quality Council, when they come up with these numbers, that gives you that 5 patients per month of time-sensitive people. They've gone back and reevaluated because their care has been awesome in flight, but their condition has deteriorated. Mr. Speaker, I speak with passion. I speak with truth. I always want to be approachable. I always want to be believable. I want to be credible, and I'll continue to do that because I believe this is the best possible solution for Albertans. In fact, I think it's going to enhance care, and talking to paramedics that I actually work with and I respect from all over this province that do such a wonderful job have not objected to.